Welcome to Monday's edition of COVID-19. We're starting the work week with a daily tally on the 400 level and against the backdrop of a virtual summit on climate change here in Korea. Now, we have more on this global effort for a greener environment later on the program. Here first is the broader pandemic coverage. Now, Seoul, we've been marking declines over the past few days here in Korea, right?
We have, Sunny. So the first, or the last day of May is also continuing on a positive note with 430 infections reported as of 12 a.m. this Monday. And that includes 411 cases that are domestically transmitted and 19 imported infections. Now, since last Wednesday, we are seeing a gradual decline in the daily figures. Although we do have to factor in that usually Monday's figure is lower on the back of fewer tests over the weekend, but we are also seeing that this Monday's figure is lower than in the past 3 weeks. So that could be translated into a positive development. Meanwhile, Korea's accumulated caseload has surpassed 140,000. And let's break down Monday's figures by region. We've got 130 infections in both the capitals, Seoul and Gyeonggi-do province, and many other spots here with double-digit figures. And here, Daegu has reported over 30 new infections. And with the UK variant prevalent in the city of Daegu in a number of cluster infections, including those linked to a nightlife entertainment venue, that's why the city decided to designate a special variant containment period until June 6th, during which nightlife entertainment facilities have to close, while recently implemented restrictions on nighttime operations at other places like restaurants, coffee shops, PC rooms, and coin singing rooms will be extended for a week. Now, Jeju-do Island raised its social distancing measures from level 1.5 to level 2. Meanwhile, beginning this Monday, also a place affected by the fast-spreading UK variant. The southernmost island reported over 300 cases this month alone, which is more than double the total figure from the entire year in 2021. And it is important to keep the number of infections at a manageable level while the vaccination program is continuing. Now we've got 5.4 million people in the country who received at least one dose of vaccination. Now, over the weekend, the government announced that Johnson & Johnson's Janssen vaccines for 1 million Koreans is expected to arrive in the country this week, which is almost double the amount the U.S. recently promised at a bilateral summit between President Moon Jae-in and his U.S. counterpart Joe Biden. And military-affiliated members will be eligible to get those vaccines. And speaking of President Moon Jae-in, who is hosting the P4G Summit, along with a main focus on environmental issues, world leaders there have called on a global coalition against the fight against COVID-19. And we will have more on P4G later in other segments.
Right, that is true. Now, meanwhile, authorities in Vietnam have reported a worrying mutation, I understand.
Right, Sunny. As if the Indian and the UK variant were not enough, this time we're hearing of a variant that has combined characteristics of the Indian and the UK variant detected in Vietnam, which, according to the country's health minister, is more transmissible than other strains. Now, more than half of Vietnam's total of 7,107 COVID-19 infections as of noon Korea time occurred in around a month since late April. And now let's take a look at countries that have much higher figures here. India at 28 million has surpassed this mark over the weekend, and Argentina is seeing resurging figures at 3.7 million, surpassing Germany's total caseload. And the total number around the world stands at 171 million. And those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Back on the local front, in commemoration of Seoul's hosting of the P4G Summit in response to climate concerns, a special exhibition is underway here in the capital city. Our Chun Song-cho is there right now. Hello, Song-cho.
Good afternoon, Sunny.
Right, so Song-cho, tell us a bit about this special event.
Yes, so I'm at the Daerim Museum in Tongidong, Jongno-gu District in Central Seoul for a special exhibition called Tong's Vintage, the Strange Tong General Store. So here you can take a look at various art pieces and you can see how waste can be recreated and repurposed into beautiful art pieces. 23 teams of artists have participated in this special project in order to raise public awareness on the environmental impact of carbon emissions on the nature. Now, this exhibition is really special. Really, even the exhibition tickets are made available digitally so that we can minimize paper waste as much as possible. And of course, you all know the drills by now. Upon arrival, before entering the exhibition venue, you have to go through a certain steps for safety and health protocols. So first of all, you need to digitally sign in using a QR code, and then you need to sanitize your hands and take a body temperature. And here there is a special gate, like a sanitizing gate, so that we can reduce COVID-19 spread as much as possible. Now, this exhibition is divided into 7 sections in total, with each section displaying art made of different materials that are put in the order of the amount of time it takes for the materials to completely decompose in nature. So first of all, we start with the slowest, which is glass. As you can see, this room is covered in different pieces, different sizes of mirror, and glass is said to take about 1 million years to completely break down in nature. And that's something that we never think about in general. So obviously, considering the amount of glass that we use in everyday lives, that's something that we need to consider. And the next section here is plastic. So here you see all these colorful toys. The key message here is that we reuse plastic toys or hand them over to other people before throwing them away in garbage so that we can get as many uses out of each plastic toy as possible. And here is still plastic, but even the disposable mask that we use these days is also made of plastic, right? So these chairs are made of disposable masks. How creative is that? And this section is iron, metal. So you see all of this equipment and drums, and you see signposts here as well, something that we use in our everyday lives. But these are also made of iron, metal, steel, and it takes about 500 years for these materials to completely break down in nature. And then we move to a different section that's on a different floor, and that is fabric. And nylon fabric in particular, it's basically a polymer, so it's a plastic as well, something that we never think of again. So it takes about 30 to 40 years to decompose. So the artists here have designed such art pieces using no plastic at all, only using vegan materials. And then you'll see like a green wall with a slogan on it that pretty much sums up the entire exhibition. It reads, "We live in green culture." And then the exhibition is followed by wood, paper sections, and then on the top floor, there's an eco-friendly section. So you see all the images of corn put on the wall, and the art pieces here are actually made of corn. Can you believe that? I don't really know how exactly it works, so I think it's time to invite one of the artists, the creative minds behind the exhibition who made this exhibition possible. So let's invite him to the show here. Good afternoon.
Good afternoon.
All right, thank you for joining our show. So can you briefly introduce your art pieces to our audience?
Hello, my name is Yu Jong-dae, and I'm an artist. For this exhibition, I present art furniture series Colors, which is made of biodegradable materials, extract from cornstarch, and try to minimize the use of materials by 3D printing technologies for the sustainable design concept. The Colors is a series of the works that express various personalities of people with interesting shape and colors.
All right, it sounds like a very complicated process, but very creative indeed. So what is the key message that you want to convey to the public, if there's one message that you need to highlight?
This exhibition is to commemorate P4G Summit. So I participate in the exhibition to deliver a message that humanity exists in the natural environment and our life cannot continue without it.
All right, that's a strong message that we all need to keep in mind. Thank you so much for your time this afternoon. Thank you.
Thank you very much.
All right, so as the artist has mentioned just now, the exhibition has been organized in order to celebrate the Seoul's hosting of 2021 P4G Summit, which is Korea's first bilateral summit on environmental issues. Now, policy works and government-led initiatives are crucial in fighting climate change. However, individual action and personal choices are as crucial. So I hope this exhibition can really encourage changes in people's behavior and attitudes so that we can put ourselves on the right track to a greener future. This has been Chun Sung-cho and back to Sunny in the studio.
All right, Song-cho, as always, thank you very much for that coverage. Right, up next, we are poised to join the regular briefing on the COVID-19 situation here in Korea for this Monday. Now, despite the decline in the daily tally over the past few days, authorities remain on high alert, given the growing presence of variants here on the local front. Accordingly, do seek to abide by prevention measures, both outdoors and indoors, to limit the risk of transmissions. Also, do remember that those interested can register for no-show surplus vaccines on the Naver and Kakao platforms for inoculation on the same day. Now, we are still waiting for the briefing to start, so let's now take this moment to remind ourselves about the possible discomforts after COVID-19 vaccination. Common side effects include pain at the site of injection, fatigue, and headaches. Now, with regard to ways to minimize discomfort, here are a few natural remedies. Try applying a cold cloth or pack on the injection site, or try gently moving your vaccinated arm to stimulate blood flow to disperse the local area of inflammation. For those suffering from fatigue, get some rest, while for fever, drink plenty of water. If you need to take a painkiller, most doctors recommend Tylenol, as it is the least likely to interfere with your immune response. Thirdly, should your discomfort worsen, be sure to dial 119 for guidance. The briefing is yet to start, so let's now take a look at Korea's social distancing guidelines in place until the 13th of June. Level 2 measures for the Greater Seoul area, as well as a few other regions, including Jeju Island, that are witnessing spikes in their daily tallies. The rest of the country faces level 1.5 social distancing. Now, the ban on gatherings remains in place, with 5 or more people not permitted to meet for social purposes, again, with exceptions in a few places that have been recording fewer cases. Also, businesses including movie theaters, internet cafes, video game arcades, cram schools, amusement parks, as well as retail stores face no limit on operation hours. Meanwhile, restaurants, cafes, indoor gyms, singing rooms, party venues and indoor standing concert places can be open until 10 p.m. under level 2. These venues, however, may see a 9 p.m. closing hour if the daily tally continues climbing or seeks to climb. Also, nightlife entertainment establishments, including clubs and bars, have been shut. Movie theaters and performance halls have to leave one seat empty between patrons or parties. Sports stadiums under level 2 can host 10% of their capacity, while those under level 1.5 can host 30%. The attendance cap on weddings and funerals stands at 99 here in the metropolitan region and 499 in the rest of the nation. Places of worship are to abide by 20% capacity here in the metropolitan region for regular sermons, of course, and a 30% capacity elsewhere in the nation. Other religious activities such as Bible study, choir practice, meal sharing and lodging remain banned nationwide. Right, the briefing's about to start. We'll come back to you afterwards.
Good afternoon. I am Commissioner of the KDCA, and let us now begin our regular briefing for May 31st, Monday. First of all, on the COVID-19 vaccination updates, about 10.5% of the total population, or about 5.4 million of the total population, have received at least one dose. And as of yesterday, we have completed about 6.5 million people in the booking for the vaccine appointments for CDCH seniors with over 60 for that age group, and also for those between the ages of 65 and 69, we have over 70% of vaccine reservation. And I would like to take this opportunity to extend my deepest appreciation to for your participation. And please note that COVID-19 vaccination is the most safest and accurate way to protect your lives and health. And we ask for you to take care of your senior parents if they are subject to the inoculation. And tomorrow we will be receiving vaccines from the U.S. That is Janssen vaccines. About 1 million doses are set to arrive tomorrow, and we have consulted with the U.S. officials, and those people will, under the group of the eligible recipients, will be the reserved forces over the age of 30 years old, and those in the defense sector as well. And they will be rolled out to these people starting from June, or early June that is, and they will be given out at designated hospitals. And we are also currently right now receiving some of the reservations for the members who are eligible. And starting from tomorrow, the 1st of June, we are going to receive the booking, and also this will be carried out from the 1st of June. And if you have not been able to receive the COVID-19 vaccination, you will also be able to be inoculated in Q3 that is. And as for the supply of vaccines, here are some updates. During 1 month of May, we have also received additional vaccines, and about 6.7 million doses have arrived in Korea, either through COVAX or individual contracts, and about 14 million doses have already arrived here in South Korea. And tomorrow we also have AstraZeneca vaccines, about 87,000 which will arrive, and we also have the Moderna vaccines, about 55,000 vaccines to arrive as well. And this is the first time for the Moderna vaccines to arrive in Korea, and starting from the Incheon International Airport, it will be escorted by our officials to the logistics center, and they will be also given out to and distributed to the local vaccination centers. And as for the adverse responses after the inoculation, here are our weekly analysis. Out of the total inoculation, we have about 0.36% of the adverse responses reported, and most of them, about 96%, were common and light symptoms like fever and muscle pain and so forth, and the rest 5% were the anaphylaxis and also other serious symptoms. And we had more women reporting than men, and we also see more in the younger age group who have higher reporting rates, while the reporting rate is also significantly lower in those aged over the age of 70. And we are having a weekly decline of these reports. And currently we are rolling out our second dose of the COVID-19 vaccines. And as for the Pfizer vaccines, the adverse responses have been higher than in the second dose compared to the first dose. And on the other hand, the AstraZeneca vaccines, the first dose had higher rates of adverse responses compared to the second dose. And please note that all of these vaccines, the Pfizer and the AstraZeneca vaccines, they have higher rates of adverse responses among the younger recipients. And as for the senior citizens, we have lower rates of adverse responses that have been reported so far. And as for the deaths of these adverse responses, they are not much different from those that have been reported in other countries, including the UK. And also we are currently looking at the correlation between the deaths as well as the COVID-19 vaccines. And right now, until now, we have 0 cases of death that have been related directly to the COVID-19 vaccine. And as for the rare blood clots, we have seen the first case here in South Korea following the vaccine inoculation.
대상자는
And this person
종사자로
was
30대 남자입니다.
30-year
4월 27일
in his 30s, and he
백신을
was a male,
접종받은 후에
and he received the
5월 9일
AstraZeneca
날
vaccines,
심한
and
두통이
on the 9th
나타나서
of May,
의료기관 방문 치료를
he
하다가
had severe
두통이
headache
지속되고
and
5월
went to the
12일
doctors.
경련이
However,
동반되어
on the 12th,
입원하였습니다.
this person was hospitalized
담당
due to severe
의료진은 입원 후
symptoms,
진행한
and
검사를
also we
통해
have
뇌정맥
conducted some
혈전증과 뇌출혈,
some of the
뇌전증을
assessments and
진단하였습니다.
also prescriptions, and we decided that and confirmed that this was a case of blood clots that have been reported, and according to our government guidelines to respond to these blood clots, we have been able to provide emergency responses to this patient, and he has recovered to a large extent. We need to monitor the symptoms going forward. However, we do not have severe reactions as of now. And currently, we have the epidemiological investigation carried out by the Seoul City, and we also have conducted our panel of experts meeting, and we have looked at this specific case, and we identified that this case was under the definition of the blood clots that have been caused by the COVID-19 vaccine. And following, we have been also looking at the antibody tests, and we have also confirmed that this person was showed positive and in these antibody testings. And as for this case, we will also have another round of screening for the compensation, which will be handed out as soon as possible. And as for these blood clots, please note that this can be recoverable if we take appropriate measures. And for the next 3 or 4 days after inoculation, you will suffer from severe headache or severe stomachache. And if you experience such symptoms, we ask you to visit a doctor as soon as possible. And as for the doctors, we ask you to check the patient's inoculation history through the DUR database, and please take appropriate measures going forward as well. And until now, as for the AstraZeneca vaccines, we have also inoculated a total of 3.7 million cases, and we have 1 case of adverse response reported right now. Of course, this is a very low compared to other foreign countries. However, we will also cooperate with the academia to provide and intensified response measures to such rare cases of blood clots. And going forward, as for the Janssen and Moderna vaccines, we will continue to have our monitoring of the adverse responses, to have in-depth monitoring as well. And we will also carry out in-depth analysis and also consultations for adverse responses after the inoculation. And we will also provide 1339 call centers, and we will have a team of experts who will provide the consultations, and they will be consisted of nurses, and they will also provide the services starting from 26th of June, and they will be looking at the reports of the symptoms, and they will also update the people with any details of the adverse responses going forward 24/7. And it is also very important to get your vaccines. However, it is also as important to monitor your conditions even after the inoculation. And after inoculation, in order to minimize any risks of side effects, we ask you to stay at the hospitals or vaccination centers for the next 15 to 30 minutes to monitor if you have any anaphylaxis or other severe allergic reactions. And even returning home, we ask you to monitor your situations and conditions for the next 3 hours. And please also note that keeping the injected area clean and sanitized is very crucial. And please monitor your conditions for the next 3 days. And if you have high fever or adverse responses, please visit a doctor as soon as possible. And we have also updates of the compensation committees, and we have had about 14 rounds of screenings, and we have looked at 308 adverse responses, severe adverse responses, and death, and we have looked at 176 cases of anaphylaxis, suspected cases, and of them, about 44 cases we have been confirmed to have the correlation with the vaccine, and also we have seen 2 cases of severe symptoms that have had the correlation of the COVID-19 vaccines. And also during the earlier round of vaccines, we have been looking at about 200 cases of adverse severe effects and also fatalities. And we also see that 12 of them had the Pfizer vaccines and 4 had the AstraZeneca vaccines. And looking at the causes of death, we have been looking at the comprehensive causes. And as for the 24 cases of death, there have been difficult to see the correlation with the COVID-19 vaccines. And as for the causes, suspected causes of these deaths, we have also strokes and also pneumonia and so forth. We also have some other severe illnesses, and we deemed that it is difficult to confirm that they have had the correlation with the COVID-19 vaccines. And as for the severe symptoms, we have looked at 34 cases, and also we have seen that most of them were over the age of 70. And as for these people, we have looked at these symptoms in a comprehensive manner, and all of these cases deemed to have no correlation with the COVID-19 vaccine. And most of them had strokes, 13 of them, and also sepsis was also followed on the next on the list. And next, as for the COVID-19 vaccine recipients, we also provide the recovery benefits. And starting from tomorrow, in order to provide provide the recipients of the COVID-19 vaccines to return to their normalcy, we will provide incentives. And please note that if you have received at least 1 dose, you will be exempted from the 8 people gathering ban of the family gatherings, and also we will also exempt these people from the computer classes and other kind of lectures at the welfare centers for the seniors, and also other silver facilities. And if they have received all of the 2 shots, they will also be able to have singing lectures and also brass musical instrument classes as well. And if you have at least 1 dose of the COVID-19 vaccines, if you are a visitor to a long-term care facility, or if you are a resident, if either side has received at least 1 dose, you will also be exempted from the virtual visits. And this means that you can meet face-to-face, and we ask you to monitor these situations going forward. And we also provide some discounts for the public institutions if you have gotten at least 1 dose of the COVID-19 vaccine. Please note that vaccinating yourself is very important to return to a state of normalcy. And as for the COVID-19 vaccines, even if you have been inoculated, please note that you need to wear your face masks when indoors. Next, we also have the weekly analysis of the COVID-19 outbreak here in the country. Domestic average cases, we have seen 562 cases, which is about 4.1% on-week decrease. In the metropolitan area, we continue to see witnesses of cluster infections, and Chungcheong and Gyeongbuk area, we continue to see cluster infections centering around indoor sports facilities, restaurants, and also nightlife entertainment venues as well. And as for the imported cases, during the past week, on daily average, we have had 21.6 cases, and this is a slight decline from the previous week. And as for the expanded rollout of the vaccines for the senior groups, we are seeing a decline in the number of fatalities as well as critically ill patients. However, on a daily basis, we are seeing our daily tally hovering around the high 500s. And we are also seeing cluster infections at offices and also restaurants and nightlife entertainment venues. This is why the quarantine measures is very important. And as for Daegu, Ulsan, and Gyeongnam provinces, we are also seeing cluster infections stemming from nightlife entertainment venues, which are spreading to the local communities. During the past week, the sources of infection, as for the contact with previous confirmed cases, they amount to about 45%. This means stemming from family gatherings, also friends gatherings as well, and also stemming from the gatherings, the contact with within the office spaces. And to this end, the quarantine authorities would like to highlight that we are seeing a continued increase of the cluster infections, and this is why we are continuing to bolster our monitoring for these multi-use facilities, including saunas and sports facilities going forward. And we will also carry out our regular PCR testings preemptively. And we ask you to comply with basic quarantine measures going forward. And we will also monitor these as well. And as for the local government, in order to identify the patients at an early pace, it is very important to get yourself tested if you have any clinical symptoms. And at the regions with high cluster infections, we are also going to carry out preemptive PCR testings. More than 10% of our total population have been inoculated. And as for these age group of over the age of 80, more than 60% have been inoculated so far. And we are right now intensifying our protection against the people who have higher vulnerability against the virus. It is very important to note that the vaccination could also expedite our return to a state of normalcy. If you have not booked your reservation yet, we ask you to also ask your senior citizens to book these vaccination appointments. And through vaccination process, until the day we reach herd immunity, it is very important that we wear our face mask, also carry out regular ventilation, and also get tested if you have any clinical symptoms. And indoors, especially in particular, even if you have been inoculated, you need to wear your masks at indoor spaces. Thank you very much.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, there was Chong Young with Monday's afternoon briefing. So what was the gist of her address today?
Well, let's focus on one post-inoculation adverse response. As Chong said, that the first post-inoculation blood clotting case in the country has been confirmed. It was a male in his 30s who worked at a virus-prone facility and has been administered with the AstraZeneca vaccine in late April. And around 2 weeks later, he developed symptoms, got hospitalized, treated, and was said to have fully recovered now. And the government is also going to compensate the patient.
I see. Well, it's quite fortunate that he has recovered. All right, so as always, thank you very much for that.
My pleasure.
더 늦기 전에 지구를 위한 행동을 시작해 주신 여러분 모두를 한국 국민들과 함께 진심으로 환영합니다. 인류의 역사가 공존의 역사로 전환되길 기대합니다. 한국은 2030 국가 온실가스 감축 목표를 추가 상향하겠습니다. 그린 뉴딜의 경험과 성과를 세계 각국과 공유하며 2050 탄소 중립을 향해 함께 나아가겠습니다.
Global leaders have urged for tangible efforts in the campaign for a cleaner world at the P4G Summit hosted by Korea amid COVID-19. And for more on the virtual climate summit, I have Professor Chung So-young from Korea University. It's been a while, Professor Chung.
Thank you. Thank you for inviting me.
Right, and I also have Dr. Oyun Sanjasuren from Green Climate Fund. Welcome to the program, Dr. Sanjasuren.
Pleasure. Thank you so much.
Meanwhile, joining us virtually is Danish Climate Ambassador Thomas Christensen. Pleasure to have you with us, Ambassador Christensen.
Thank you very much for having me.
Right, we'll start here in the studio then. Professor Chung, let's start with the significance of the two-day virtual summit on climate change that began on Sunday amid the pandemic.
Well, I mean, there are significant, there are very significant implications of, Korea hosting the P4G Summit meeting. First of all, Korea can add important voices to a series of international efforts to climate change this year. In the middle of the COVID-19, but we still have many important climate change meetings scheduled or ahead. First, U.S.-led climate change summit meeting, and then we will have an important G7 meeting scheduled where we're going to talk about the climate change. Also, finally, November, a COP26 meeting in Glasgow. And here, Korea can make a significant voices. And in the context of actually playing the preaching role between the developing countries. Among the hosts, Korea is classified as one of the developing countries in the sense that Korea make a significant contributions to this endeavor of the world.
Right. And Ambassador Christensen, what can you tell us about the progress made towards green growth since the first summit in Denmark back in 2018? And what perhaps is notable about the second summit here in Korea?
Well, first of all, of course, the context, the pandemic, is really a marked difference, but also gives some opportunity for relaunching recovery in a green direction, as Korea is doing with its Green Deal, and setting the tracks to a low-carbon way out of the pandemic. Also, I think we're looking at a world where multilateralism will be strengthened. We've had to work together to tackle the pandemic. We will have to work together also to tackle the climate crisis, which is upon us. Also, we've now had 3 years since Copenhagen to make the proof of the concept that partnerships for development and for climate action are necessary to move forward as a global community. And we have seen that there is actually a great pickup of the notion of partnerships. The UK COP presidency that the professor referenced in Glasgow is now planning for a whole climate action track where this summit will feed in a number of partnerships and action movements that will help elevate also for business leaders the concept of climate action to a much higher place.
Right. And keeping in mind what Ambassador Christensen has just said, Dr. Sanjasuren, what are your thoughts on the role of the P4G in better addressing the globe's climate challenges?
Well, I think it's hugely important. Of course, for any important, challenging issue, global one, to go forward, two things are very important: political will and public support. I think there is a huge public support, for the world to leapfrog to greener, cleaner, but also more low-carbon development. And platforms like P4G Summit actually get the attention of the world leaders and gets them rallying behind, and this time it's green recovery, right? The theme of P4G Summit is green recovery, which is very important because on one side, of course, COVID brought unprecedented crisis to the world. Economy went down, millions lost their jobs, and many also, millions lost there were millions of deaths. But I think it's very important now to also get the recovery right. And I think Korea is one of the few very successful countries that are really trying to get the recovery right. I say very few because if you look at various data, in the last just over a year, about $14 trillion have been mobilized for COVID recovery, as it were, and mostly, and of course, in OECD countries, in large economies. It's much more difficult to get also financial packages for the developing countries. But if you look at this $14 trillion, less than 3% actually went for green recovery type of measures. And the Green New Deal of Korea is actually a very strategic choice and very strategic policy where if you have to unleash this unprecedented volume of resources, and you have to spend, you can't spend on 100 things, but you have to spend on 20 things, but you are very smartly and strategically spent on green jobs, on green industries. You must not bail out carbon intensive or polluting industries. So I think in this sense, both Korea's example is very important, but also Korea's leadership in convening and getting attention and focus of world leaders and international organizations for this green recovery cause is very important.
Right, so we are on the right path here in Korea.
Absolutely, thank you.
Professor Chung, now I understand this is the million-dollar question, but what do you propose as part of efforts to perhaps bridge the gap over differences among nations and among companies with regard to carbon emissions?
Not because that our director from GCF is present here, but I personally, and I think in general, we strongly believe that all answer comes from the finance issues. And then looking at the global climate, change, environment in general, that there is a significant need to mobilize, finance to support the developing countries, not only to address the COVID-19, also realize the, green growth and then the low carbon development, the carbon neutrality, whatever you want to call. And in the sense that there is a strong need to bring the new concept of blended finance, matching the private sector investment, also supporting the private sector's investment by public sector side, like a GCF. So in that sense, it's very important. So that also relates to your second part of the how we match the gap between the government and the private sector. It is also, once again, in that area, the blended finance concept can ensure that the private sector would feel more comfortable enough actually to go into the more risky places. To them, the developed countries, there are so many risks, political, economic, technical, and the public sector's role is to manage all these things. And so eventually, all this aggregate amount of big money, finance, can solve the problems.
Right. And Ambassador Christensen, what would you say is the role of the P4G members amid the pandemic? And perhaps, in your opinion, what is the most pressing issue with regard to climate change?
Well, the most pressing issue is to bring down carbon emissions. That is to lower the output from energy generation, industry, and transport. While the solutions, as I said before, need to be global and collaborative, the big difference between, say, tackling the pandemic and tackling climate is that for the pandemic, we could put our economies on hold. We could wait to find the vaccine. We could, in a way, take a step back while we were finding solutions. On climate, we cannot do that. We cannot put the planet on hold. So we need to scale up and speed up our efforts to bring down emissions and to put in place alternative ways of generating energy. And I just wanted to mention that actually yesterday, under the heading of the summit, Denmark and Korea decided to elevate our Green Growth Alliance to what is now called a comprehensive green strategic partnership. And that's with an increased focus on renewable energy, sustainability, green transition, but also cooperation in life sciences, healthcare, technology, innovation. And under that framing, just in the last few days, 3 major memorandum of understanding were concluded between Danish and Korean partners on the development of offshore wind in Korea, but also, I think, over time that will allow Korea to meet its renewable energy targets and, in a way, understand how to also become a green tech power in Asia for the export of renewable energy, energy efficiency, and other technical solutions of tomorrow. The fossil solutions will very much be the technologies of yesterday.
Right, which also shows that collaboration is very important, of course. Dr. Sanjasuren, you've mentioned the importance of financial support in resources, that is, in reaching our green growth goal. What can you share with us about the flow of funds to support the goals of your entity, Green Climate Fund?
Yes, no, absolutely. As Professor Chung said, finance is absolute key. Korea announced net carbon neutrality by 2050. Again, of course, European countries, US recently, China, Japan, so it's hugely important. On top of that, more than 120 countries, now 123 countries joined the race to net zero, which is very important. However, for most of the developing countries, for those who joined race to net zero, the success will depend on the availability of climate finance. And so Green Climate Fund, which was created as part of the UNFCCC and Paris Agreement, were at the center of the what's called financial mechanism. Basically, we're the bridge between those who would be financing those investments and developing countries that are very eager to actually invest and leapfrog to greener development. Now, Green Climate Fund currently has about $30 billion worth of portfolio. About just over $8 billion comes from the GCF resources, and the rest is with co-financiers from our partners, including private sector. So it's very important that just increasing the volume of finance is not enough. One needs to innovate, right? Different types of financial instruments like de-risking the private sector capital. If private sector wants to leapfrog and go for greener investments, private sector, maybe $1, needs to de-risk $10 worth of private investment for them to sort of allow to create some bespoke solutions so the private sector can leapfrog to greener investments. Of course, it's not only investment in financial terms, it's also investment in policy, the regulatory, right? De-risking also the policy and regulatory framework. Also, of course, providing support for technical assistance and capacity building. And currently, with COVID, of course, as we were saying, if Korea invests and then the co-benefits go to both COVID recovery, but also green and climate and sustainability, that's, of course, much smarter.
I see. I would like to continue. Unfortunately, we have a lack of time here, so I'll have to end our discussion here today. Dr. Sanjasuren, thank you very much for your words. And Professor Chung, thank you very much for being with us today. And Ambassador Christensen Ever, thank you very much for making this time to join us live at this very early hour at your end.
Thank you.
You're most welcome. Thank you very much.
Right. Well, green we go, change we make. Now, that's the slogan amid the Seoul Summit on climate change. And that's the goal beyond the pandemic as well. Thank you for watching.